Hi, welcome to 5 Minute Videos for the NCE Review. This is Dr. Pepe, and today we are going to go over Domain 2, Intake Assessment and Diagnosis, and we are in subcategory R, Evaluating the Interactional Dynamics. Now, when you hear the word interactional dynamics, that is referring to the relationship, the therapeutic alliance you may hear. You may also hear how strong the bond is between the counselor or the therapist and then the client. So, some people describe it as a synchronicity between the therapist and the client. Um, for most in the field, they're looking for things such as is it authentic? Is it intimate? Are the interactions helpful for the client in the healing process? Now, with counseling, there are many theoretical frameworks. Rivera has suggested that there's about 200 different approaches. But within those approaches, there has to be what Carl Rogers called the core conditions. And that is, what conditions are visible within all the different approaches in an effective therapeutic alliance. So, some of the things to keep in mind when looking at a therapeutic reliance or when looking at how that interactional dynamic is playing out is looking at what is successful. And we know based on some of Hubble, Duncan, and Miller's work that 15% of treatment can be attributed to techniques, but a lot of it has to do with the relationship, and that relationship is that dynamic which really makes or breaks a therapeutic relationship. So again, Dr. Rogers, he talked about those core conditions: being empathetic, understanding, being genuine or congruent, and then not judging, or he defined it as unconditional positive regard. So accepting, not being judgmental uh, by the actions or what the client is saying. So, one of the things that you should keep in mind whenever you're talking about a therapeutic alliance, whenever you're evaluating the interactional dynamics, is the notion of transference, and that just to me, that there's kind of technical definitions, but to me is how is that relationship affecting either party, whether it's a transference or what they labeled a counter transference. How are you reacting, or how is the client reacting to that dynamic? And for many, based on gender or ethnicity or religion, that can be something that they don't even realize. But as a professional, that's something that you have to keep in mind. Also, the notion of working alliance, right? There has to be buy-in, and the client has to have a hopeful belief that they are, that they can get better, and that it is possible for change to happen. Then in the field, Laborsky from the 70s mentioned kind of the four stages of the alliance. So they mentioned the commitment, being willing to go through the therapeutic process with all the different risks. the process, understanding, what that looks like. The third one is change. So understanding first the commitment, second would be the process, third would be the change, and then fourth would be the termination. So those are kind of the four stages that are usually determined as to how effective a therapeutic or a counseling relationship is gonna be.